Thank you, Chairman Rangel, Representative Camp, and members of the Committee on Ways and Means. My name is Dr. John Ayanian. I am Professor of Medicine and Healthcare Policy at Harvard, a practicing physician at Brigham and Women's Hospital in Boston, and a member of the Institute of Medicine Committee on Health Insurance Status and its Consequences. I'm honored to present to you today the Institute of Medicine's most recent report, America's Uninsured Crisis: Consequences for Health and Health Care. Our report addressed three key questions. First, what are the dynamics driving downward trends in health insurance coverage? Second, is being uninsured harmful to the health of children and adults? And third, are insured people affected by high rates of uninsurance in their community? The first topic of our report assessed the continuing decline in health insurance coverage. With eroding private coverage and expanded public programs from 2000 to 2007, the proportion of uninsured children remained steady at about 11%, while the proportion of uninsured adults increased from 17 to 20%. The principal cause of declining private insurance coverage has been the rising cost of health care. Between 1999 and 2008, family health insurance premiums rose nearly 120%, more than triple the increase in workers' earnings. Employers are less able to sponsor coverage, and employees are less able to afford the premiums if coverage is offered. Our committee concluded that these trends will not reverse without concerted action. Current economic conditions and rising unemployment will only exacerbate the problem as more individuals and families lose employment-based coverage. The second major topic of our report focused on the health consequences of being uninsured for children and adults. Based on nearly 100 new and generally stronger studies that we reviewed, we found that uninsured Americans frequently delay or forego doctor's visits, medications, and other effective treatments, even when they have serious or life-threatening conditions. Uninsured children receive fewer immunizations and basic dental services. With serious conditions such as asthma or diabetes, they have more unmet health care needs. Uninsured children are also more likely than insured children to miss school due to health problems. Among uninsured adults, 40% have one or more chronic conditions such as high blood pressure, diabetes, or depression. Many of them receive little or no medical care, and their health declines more rapidly than for insured adults with these conditions. Uninsured adults are also more often diagnosed with later stage cancers. As a result, they are more likely to die prematurely than insured adults, and with serious conditions such as heart disease, cancer, or trauma, their risk of death can be 40 to 50% higher. Fortunately, our committee also found good news to report about the benefits of gaining coverage. When uninsured children gain coverage, they have serious health problems identified sooner, better preventive services, fewer hospital stays, improved asthma outcomes, and fewer missed days of school. When uninsured adults enroll in Medicare, they receive more appropriate tests and treatments that improve their health and prevent costly complications. Their risk of death is also reduced when they are hospitalized for heart disease and other serious conditions such as strokes or hip fractures. Therefore, our committee concluded that lacking health insurance is hazardous to the health of children and adults. More importantly, gaining health insurance provides substantial health benefits to uninsured Americans. The third and final topic of our report focused on the effects of high rates of uninsurance for Americans who have health insurance. When rates of uninsurance in communities are relatively high, insured adults report more difficulty obtaining needed health care and less satisfaction with the care they receive. Furthermore, weaknesses in local health care systems are intensified by high rates of uninsurance, and these problems have potentially grave consequences for the quality and timeliness of emergency services and trauma care for everyone in the community, both insured and uninsured. In conclusion, we determined that the evidence on the adverse health consequences of being uninsured is stronger than ever before. This evidence makes a compelling case for urgent action because insurance coverage matters for the health of children, adults, and communities. Given the harms of lacking health insurance and the benefits of gaining coverage, the Institute of Medicine recommends that the Congress and President work with other public and private sector leaders on an urgent basis to achieve health insurance coverage for everyone, and to reduce the escalating costs of health care to make coverage for all sustainable for the nation. Thank you.